It has now been more than a year since the U.S. Supreme Court overturned the landmark Roe v. Wade decision, which protected reproductive rights nationwide for nearly half a century. Since that decision, 21 states have restricted or outright banned abortion care. Others, like Washington, have expanded care. And here in Maine, a big topic of debate among lawmakers recently was whether to pass a bill that would allow abortion to be performed later in a pregnancy. In Indiana, lawmakers approved a 13-week abortion ban in their state. Because of that, women are now undergoing some extreme measures of birth control. Lexi Wilson has more.
The motion carries.
In the months since North Carolina lawmakers approved a 12-week restriction on abortions, doctors say the number of women requesting sterilization to avoid pregnancy is rising.
But what I hear from my patients is that they just want to be extra sure given the reproductive health policy environment in North Carolina.
Dr. Kavita Aurora is an OBGYN at the UNC School of Medicine. She believes requests asking for permanent sterilization procedures like a hysterectomy or a woman getting their tubes tied is directly related to state abortion laws and to the U.S. Supreme Court's decision to overturn Roe v. Wade.
That there is no longer wiggle room or room for error. And all forms of birth control, even if perfectly taken, are not 100% effective.
That was kind of what really pushed us to try to find a doctor.
28-year-old Kelsey Rayfield is among a growing number of women in North Carolina choosing permanent sterilization in the wake of new abortion restrictions. She's had a hysterectomy done recently by a Shelby doctor, but it wasn't easy.
There's a lot of pushback. Most of the places we had called wanted my husband's permission and kept saying we would change our mind.
Since the procedure is permanent, some doctors are reluctant, especially for those who are younger, but Rayfield says she's confident in her decision.
It's my body. It's my life.